The country continues to contain the spread of the deadly coronavirus. Mass testing still remains a hard nut to crack due to inadequate testing kits. There is a shortage of nasal swabs used in sample collection, a gap that Simon Ndirangu, a Kenyatta University fourth-year biotechnology engineering student, seeks to bridge with his innovation of the 3D printed, locally made swab.
Kenyatta University fourth-year biotechnology student Simon Ndirangu has come up with an innovation that uses 3D printers to produce and develop improved nasal swabs used in collection of COVID-19 samples. The 28-year-old had a light bulb moment when the Ministry of Health Cabinet Secretary Mutahi Kagwe on April 4th called on the youths to be part of the solution to the problem that the country and the world at large is facing. Largely till date, the Ministry of Health is yet to carry out a successful mass testing exercise owing to the shortage of critical medical supplies used in testing coronavirus.
When COVID-19 struck the country and in the world, I embarked on research to find some essential supplies that are needed, because now we have global disruption of manufacturing of medical devices. And one of the most needed devices in the world is nasopharyngeal swab. As the CS was insisting sometimes back that there is no enough supply of these swabs.
When the government realized it was spending a lot in importing of supplies such as PPEs and other grade 1 medical equipment, the government called upon higher learning institutions and research centers to come up with ways some of these essentials can be produced locally. And with learning halted in universities, the biotechnology student sees the opportunity to do research and work tirelessly day and night at the Kenyatta University's Chandaria Innovation and Incubation Center to come up with the idea, which he ran by his associate lecturer, Stephen Runo.
When I was doing my research, I was able to work with even the doctors who are in the field. For example, I was working with one Dr. Jesse Cox, who is the director of University of Nebraska Medical Center in the US. He was able to give some guidelines of what they need in the field, and we've been in consultation with him. I've also been in consultation with some personnel in the university, like my supervisor, Professor Stephen Runo, who is the chairman of biochemistry, microbiology and biotechnology.
After he informed us about his innovation, we had to engage the university. And the university engagement comes from the Office of the Research, DVC Research, Innovation and Outreach. And then through that, the university management then has to approve resources to help the pilot or the piloting of the project.
Using the 3D printer, Simon is able to produce over 3,000 swabs in a day, but this will be improved after some logistics are taken care of.
One of the things that the initial swabs have, or what people are currently experiencing, is that they are quite invasive, the way that they go to collect tissue. What we have done, or what Simon has done, is to make them as flexible as possible, so they are friendlier to the person that is being tested, and there are safety measures that have been taken to avoid cross-contamination. And one of the things that Simon has done is to develop a way that this can be broken so that you don't have to use scissors when you're collecting the samples.
For the nasal swabs to hit the market, they still have to undergo a clinical trial supervised by medical experts. Medical equipment such as these can only be produced or manufactured in registered research centers and medical facilities, according to the WHO guidelines.
We are working with Kenyatta University Teaching and Referral Hospital for validation studies. We are expecting that between 1 or 2 weeks, we'll be able to have all approvals and we'll be able to do mass production.
I'm a supporter and a very big supporter of homegrown solutions. So when you see a problem, your job as a scientist or your job as a student is to, as much as possible, try and find solutions from within. So I'm quite happy with this because it is homegrown. It is solving a problem that we have here.
The coronavirus pandemic has led to homegrown solutions in productions of essential medical equipment that are used in fighting the COVID-19. And if Simon Ndirangu's innovation will get approval, then this will reduce Kenya's dependency on imports of level 1 medical equipment. Samson Jura, KUTV, Nairobi.